Hello, I'm Dr. Abhishek Mangeshikar, and today we're tackling a subject that's full of misunderstandings: endometriosis. Despite being a condition that affects hundreds of millions of women worldwide, there are still many myths and conceptions that can lead to confusion, delayed diagnosis, and inadequate treatments. In this video, we're going to debunk some of the most common myths about endometriosis so you can have a clearer understanding of the condition and take control of your health. One of the most common misconceptions is that endometriosis is simply a case of severe menstrual cramps that can be managed with over-the-counter pain relievers. While it's true that painful periods are a hallmark symptom of endometriosis, the condition is much more complex than just bad cramps. Symptoms can be a myriad of things and are far more severe than regular uterine contractions during menstruation. They can range from pelvic pain, back pain, leg pain, bladder pain, painful sex, painful urination, painful defecation, shoulder pain, chest pain, breathlessness, foot drop, urinary retention, kidney failure, intestinal obstruction, etc. So, a little more than just a bad period. Another common myth is that endometriosis is a condition that primarily affects older women, particularly those nearing menopause. This is far from the truth. Endometriosis can affect women of all ages, including teenagers and young adults. In fact, many women start experiencing symptoms in their teens or early 20s, but due to lack of awareness, they may not receive a proper diagnosis until much later in life. Early recognition of symptoms is crucial because it allows for earlier intervention, which can help manage the condition and reduce the risk of complications like infertility. The youngest patient I have operated on was 8 years old and the oldest was 65. So let's stop calling it a disease of the reproductive age, unless you live in the age of the Targaryens. Many believe that pregnancy is a cure for endometriosis and that once a woman has given birth, her symptoms will disappear. While it's true that some women experience relief from symptoms during pregnancy due to the hormonal changes, pregnancy is not a cure for endometriosis by any stretch of the imagination. The symptoms of endometriosis will return after childbirth, especially once menstrual cycles resume. Endometriosis is a chronic condition that requires long-term management. Treatment plans should be individualized and not rely on pregnancy as a cure. Some believe that a hysterectomy, which is removal of the uterus, is the only definitive cure for endometriosis. However, this is a horrible misconception. While a hysterectomy may be recommended in severe cases, especially when there is adenomyosis or multiple uterine fibroids or uterine cancer, it is not a guaranteed cure. Endometriosis involves tissue that grows outside the uterus, meaning that removing the uterus alone will not address the disease outside the uterus. There are other treatments available such as excision of the endometriosis, which involves removing endometriosis disease, and also some hormonal therapies which can be effective in managing symptoms. It's often thought that all women with endometriosis will struggle with infertility and that having children is not an option. While endometriosis is indeed a leading cause of infertility, not all women with the condition have difficulty conceiving. Many women with endometriosis can and do have successful pregnancies, either naturally or with the help of fertility treatments. Early diagnosis and treatment are key to preserving fertility, and there are many options available to support women with endometriosis who wish to conceive, including fertility-enhancing surgeries and assisted reproductive technologies like IVF. There's a belief that if you have endometriosis, your pain must be extreme and debilitating, and if it's not, then you probably don't have the condition. This is not necessarily true. The severity of pain in endometriosis does not always correlate with the extent of the disease. Some women with mild endometriosis may experience severe pain, while others with extensive disease may have little to no pain at all. Endometriosis is a terribly complex condition and symptoms can vary widely from one person to another. Any persistent pelvic pain should be evaluated by a healthcare provider regardless of its intensity. Some people think that endometriosis is rare, affecting only a small percentage of women. In reality, endometriosis is quite common. It is estimated that 1 in 7 females worldwide are affected by this disease. Despite its prevalence, it is often underdiagnosed due to a lack of awareness and the stigma surrounding menstruation and pelvic pain. This makes it all the more important to raise public awareness and ensure that women receive timely diagnosis and appropriate care. To recapitulate, endometriosis is a complex condition that's often misunderstood, and these myths only serve to make it harder for women to get the care they need. By debunking these common misconceptions, we can ensure that those affected by endometriosis receive accurate information, proper diagnosis, and effective treatment. If you found this video helpful, please share it to help spread awareness and correct misinformation about endometriosis. And if you have any questions or would like to share your own experiences, leave a comment below. Remember to consult with a healthcare provider if you suspect that you have endometriosis or are struggling with related symptoms. Don't forget to like, subscribe, and share this video to help raise awareness about endometriosis and support others who might be navigating this condition. Thank you for watching and stay tuned for more videos on women's health.